Hello everyone, this is the Scientist and welcome to another audio podcast on this series that will relate to the introduction of the fifth series in the audio and podcast. And this series is going to be about the Ztormtronix case review, and this particular podcast, audio podcast, is about healthcare and the science Labscape. I'm going to talk a little bit about healthcare and science, and what that bringing together some of the understanding from the previous some of the previous audio podcasts that have taken place through the other series that have taken place through Ztormtronix, Storm Labscape Productions, and also highlight how this is going to link with areas of healthcare, areas focuses around laboratory practice again, and a bit more about science and how science, at least where healthcare is concerned, is a sort of a mixture between what happens inside a laboratory practice and laboratory medicine, and also external to that, and how healthcare scientists practice beyond laboratory practice, i.e. Labscape. And so I'm going to provide this audio podcast with a brief introduction, a little bit of a sort of a landscape perspective, then some aspects on public health, and then I will provide a summary with some resources for further reading, so listeners can take a look at some of the resources at their own time, in your own time. So let's begin. As part of this introduction, I'm going to highlight that long-term conditions are now perhaps some of the most common causes of disease and death in the UK, and if not in the broader world. There are notwithstanding, there are various challenges, and more than 15 million patients have some sort of ill health or comorbidity, such as hypertension, asthma, coronary heart disease, chronic kidney disease, and or other healthcare burden, and there is various literature that highlights sort of the epidemiology and the statistical analysis around that. There is actually a paper by Bello, I think the author's name is, a paper by sorry, not Bello. Bello is one of the authors. Someone called Smekal, and it's a paper published in the BMJ open journal, and it's original research and is relating to enhancing primary care capacity in chronic kidney disease management, and it's a quality improvement educational initiative paper. And I'm not going to delve into this in this work too much, only that it is worth listeners having a glance at that. Basically, the team who did this work looked to understand how educational intervention was used and targeted to provide in a Canadian province, which was deemed to be quite successful, and there were workshops involved to get patients and the lay public involved to actually get understanding and perspective. So it's quite a intriguing sort of read, and I'm not gonna get into that too much, but suffice to say, it is actually quite a good paper to refer for listeners to refer to, and patients tend to be can be at least those patients with different kinds of comorbidities of health concerns can be or are referred to as high users of healthcare resources, and at least in the UK, from a UK perspective, they account for at least 50% of general practitioner appointments, about 64% of outpatient appointments, and 70% of any admission in hospital bed admission, inpatient or admission to hospital in one way or another. And so that's been documented by the Department of Health in a publication from 2012. Special analysis of end of life research has also indicated that an estimated of 18%, so nearly 20% of patients with a long-term condition are in receipt of state-funded sort of healthcare resource, and a small proportion of those are with most disabling or complex conditions, and less than so disabling or complex conditions and receive sort of ongoing healthcare from the National Health Service, at least that's based in the UK. And also to highlight that are currently patients who are sort of referred to as a burden to healthcare as well, in one way or another, at least in literature, is a kind of paraphrased in a different context, but suffice to say that there is because of the number of comorbidities that individuals might have, and the burden that has on the healthcare resources, there are points during the sort of review of budget healthcare budgets and reviews that normally take place on an annual basis, there is literature to highlight that there are differences and resources as to differences and the amounts of resources that are allocated to different areas of healthcare practices are budgeted sort of accordingly, and this context comes out of work and research that's been highlighted by the Department of Health in 2013. Patients also with long-term conditions still may require different kind of other sources of support in one way or another, but mainly where these are concerned, where that sort of support is required and or might be needed or required. That is down to how epidemiological studies and statistical analysis focuses resources to align particular healthcare strategies. Patients in that regard are then become sort of almost a resource in their own entirety, so that in one or two regards, basically, where in literature that relate to that focus and relate to patient and public involvement and sort of participatory medicine, that kind of those kinds of research highlight where and how patients are an advantage where involvement is concerned, and thus helps supports those who, the understanding of those who are service providers to understand, so that they know where sort of the healthcare landscape is sort of always sort of ensuring that patients have the best out of their healthcare experiences, etc. And this may also include to enhance the ability to manage, at least from a healthcare and science Labscape perspective, where service providers are able to focus the budgets and that they have amongst them to enhance the ability to and ensure that any tests or investigations that are required for areas of healthcare for service users, and that they are able to have appropriate lines of measure, so that they can audit and audit accordingly and ensure that they are not being too rigid around aspects of their healthcare resources from a quality where quality of healthcare could easily be compromised. So in this regard, also there's literature dating back around 2007, and actually a little bit further than that, retrospectively, work by Williams and team in 1998, and Soclarides and team in 2007, highlight that the sort of the kind of the consequences, in aligning to areas of burden on healthcare, and where sort of where there can be a misalignment between health professionals and service users, because of the fact that there is little, or can be little, joined up thinking to focus what is really beneficial to patient care. And so I'm now going to highlight that. Yeah, so sorry, before I go further, just to say that in the paper by Smikau, is one Smikau and team in 2021, that particular paper has various focuses around educational interventions, from a primary care perspective, and therein lies some issues, because most healthcare resources have for a very long time focused mainly in primary care, and at least where some healthcare conditions are focused between healthcare sectors. And so in this context, primary care teams that are willing to be able to signpost patients to appropriate support, including those resources through online spaces, for example, could perhaps do more to improve quality of lives. And that's something that was actually highlighted in work by Williams and team in 1998. But the paper by Smikau in 2021, this year, Smikau and team that was published this year, focused on some of this some of the sort of updated areas of healthcare that align to bridging and linking the things that the focuses that happen, the areas of healthcare that are more intricate in secondary care or versus primary care, and where they implement some sort of intervention to highlight that there's some preliminary pilot study data that focuses that effort, that actually help bridge certain aspects of healthcare, and that notwithstanding, there is again, listeners, you will probably be aware that there is a paper by Mohammed and a team from 2020 that sort of highlight sort of a focus on educational support, and this was published in a Turkish journal of nephrology, and it was Mohammed's work back then, retrospectively, not retrospectively, but recently, in a short time, highlighted that online spaces can be supportive and what should or probably should be encouraged or could be encouraged is allied health professional, more from various disciplines or areas can be involved in online spaces to actually bridge that focus, especially addressing issues that people, service users in online spaces kind of look to share their experiences or an understanding. And so that then actually that work I won't go into it too much, but again, as you know, listeners, I do sort of talk a little bit about the works of the Renal Patient Support Group, or the RPSG, and it's worth checking out that work. And if you can get access to those that paper by some of these kind of authors, then do feel free to do that, because that's helps bring sort of a robust understanding about what could be done in between healthcare sectors a bit better. Now I'm going to talk a little bit about the landscape perspective. So there was a document. Sorry, there was something called in the UK. There was the Health and Social Care Act 2012, encouraged competition between organisations and championed the commission and championed the sort of a premise where areas of healthcare could be focused with regard to budgeting, and this was the report. There is a report again, I think, in the Department of Health document in 2012, but also how the Health and Social Care Act highlighted some of this context. And as you know, listeners, I'm not into talking too much about social care and aspects of sociology, but suffice to say that, or at least highlight that, that in the UK, or from the UK perspective, there is the Department of Health and Social Care, or DHSC, which was aligned and linked also with NHS Digital, kind of unfortunately, there's kind of no way of getting away from that. So in parts of these sort of bursts of audios or podcasts, I will highlight a little bit where there is attempts for integrating areas of healthcare for the better, and I wouldn't say that they failed. I'm not going to say that they've not been able to, but unfortunately, the way healthcare has been sort of in certain areas between healthcare sectors, and how resources have been used and delivered, and healthcare has been delivered. There has been sort of misnomers around that. However, since 2016, NHS England, or the National Health Service in England, has required all health organizations to operate as one of 44 geographically based sustainability and transformation program, or STPs, and I think that had been highlighted in one of the audio or podcast before, but there is a document in NHS England in 2016, and it required actually sort of those sort of heads or figureheads from a different organizations in sort of defined geographical areas to work together or collaboratively to drive forward an integrated effort to close the gap between health disparities or healthcare disparities, and also improve health and healthcare services, and align finances better and smarter, at least in the short term. The represented what had been documented by NHS England in 2016 had actually highlighted a radical sort of a shift in the way that the NHS was expected to plan its services or areas of its services. However, whilst STPs, sustainability transformation or transformation program or partnerships, STPs, are sort of not sort of legal entities. There are various organizations that comprise each STP, and having different based on the sort of challenges that are aligned to healthcare in for the patients that are served within an area that is linked to an area of healthcare that is linked to also a geographical sort of focus as well, and so that also then means that with these different challenges, there are different sort of strategies and priorities, and sort of where funding for different things in healthcare, for example, has required different sort of modeling as well, but also how STPs, or at least in part, and also I'm going to mention a little bit about something I mentioned before in a previous audio and podcast in a previous series, and that is to say that PCNs or primary care networks kind of are in keeping, or are in linked have a linked, or that there's a transferability aspect between PCNs and how they operate, and STPs, and basically the idea is to ensure there's accountability between health professionals, but also how PCNs, for example, are do or should be encouraging more sort of allied health professional involvement around different aspects of healthcare, depending on requirement and sort of need, based in between healthcare sectors. And having said that as well, though, restricting progress towards what STPs have done in one way or another, is that where there has been or evidences that have um, uh, where there has been evidences of where resources have not been applied properly, for example, that can obviously restrict and has does restrict that sort of integrated um, uh, integrated a link between healthcare sectors, and thus restricting progress towards achieving more of vertical and horizontal alignment of NHS or National Health care services, and that's again documented in NHS England in 2000 from 2016. And In line with this, I'm now going to just highlight a little bit about the public health perspective on this, and a key a sort of a main requirement with direct implications of for public health management, or PHM, is that what is that or was that by April 2021, every local health and care organization was to be expected to become part of a sort of an integrated care service in one way or another, and again that listeners should read kind of refer to the long-term NHS long-term care plan, or long-term NHS long-term plan, which was published in 2019, and basically how integrated care services, again, word terminologies relating STPs, PCNs, and ICS, or integrated care services, in one way or another, they're kind of can be used synonymously, but obviously they have separate entities as well. ICS is basically where there have been some attempts to align healthcare and between healthcare sectors according to care pathways according to particular sort of long-term care pathways relating to disease and ill health. The NHS long-term plan, which was published in 2019, I believe, identifies that the need for streamlining for areas of between healthcare sectors, typically involving local organizations to kind of apply aspects of their their commissioning and funding, so that there is more linked and effort of aligning areas of service and healthcare to population health, but also where there may be evidences of sort of where areas of integrated care services have not, if they've not worked very well, for example, then there should be an effort where those who are sort of figureheads looking into those areas of healthcare and decision making, then there is every every attempt to ensure there is appropriate resourcing, that might also require a different NHS 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 care and review of particular services as well. So I'm now going to provide a brief summary on this. One of the main ambitions in the NHS long-term plan from 2019 was to ensure that between healthcare sectors there's more sort of digital first health and care service, and actually to ensure that there is a more link to areas of public health, where at least with those sort of recognizable disease and trends are concerned. And whilst NHS England consider that changes set out in the NHS long-term plan in 2019 can be generally achieved without changes to sort of pinpointed areas of legislation, it acknowledges that this could also speed up focuses between areas of healthcare where comorbidities and multimorbidities can be understood, but also tackled in a more harmonious or holistic way. And consequently, it sets out a list of provisional suggestions for amendments that could accelerate around service integration, administrative efficiency, and also and of course areas of accountability. So that's all I'm going to say around this podcast, this audio podcast, which was the first audio podcast in the 5th series around the Ztormtronix case review. This has been the scientist, and I am going to now provide a few resources where listeners can check out these at their own time, and hopefully can be quite good. And some of these would have been mentioned previously, but it's always good to sort of give another. If I wanted to give another review on this. So Barnett and team in 2012 published a paper on epidemiology of multimorbidity and implications of healthcare research and medical education, and it's a cross-sectional study, and it was published in the Lancet. There's a book, there's a digital framework for allied health professionals published in 2019, and this is downloadable if you put that a digital framework for allied health professionals in the search engine. There's another paper by framework, that was published in 2017, Allied Health Professions into Action, and that was again published in 2017. There's works by Green and Hibbard from 2012, which is really quite intriguing. Why does patient activation matter? An examination of relationships between patient activation and health related outcomes, and that was published in the in an internal medicine journal. There's a paper by Halmaker and team in 2008 and it highlights they highlight early experiences with personal health records, and then there's work by as I mentioned before, this author, Nutbeam, in 2018, and team highlight some work around health literacy in context, and it was published in a public health journal. Then there's work by Stevens. Stevens. This is quite an old paper, but it's quite a good one. Looking at really aspects of professionalism, and areas of professionalism between different kinds of health professionals in healthcare. And this actually was published in a journal. It was actually the paper was published in a journal by Sociology of Health and Illness. Then there is works by the full paper by Williams and team in 1998, relationship of functional health literacy to patients' knowledge of their chronic disease. It's a paper published in the Archives of Internal Medicine, and it was a study of patients with hypertension and diabetes. And then there is a paper, if I can, yes, there's a King's Fund report, and I have mentioned this before in a previous audio podcast, but it is quite a good one, and it's titled "A Vision for Population Health Towards a Healthier Future," and that was published in 2018, and it is accessible online. And there is one by the King's Fund in 2000. Sorry, that was in 2018, and there's another report by the King's Fund in 2013, delivering better services for people with long-term conditions, and that's quite a good one to check out as well. So there are in this list, there's quite a lot in this list, but hopefully, all being well, you can listeners can check these out at their own time, and when looking at when referring to at least one paper, then there's several references that will come out of those, and basically listeners can get an understanding, kind of contextualizing, sort of their own evidence as they go through. That's it then, listeners. This has been The Scientist, and I hope it's been of intrigue, and it's been another Storm Robotics production. Thanks for listening, and hopefully we'll catch you for the next one. Thanks then.